We decided to get one of the common confusing questions out of the way up front. Possibly due to the description of the two activities, they can be used almost interchangeably. Is case management and caseload management the same thing?
No, it's not. And case managers have a caseload that must be managed, just the same as any other therapist or practitioner. Case management, in a nutshell, is about making sure that your client has the services and the support that they need. That's what it's about. And your clients, we're talking about people who have had catastrophic injuries, things like brain injury, or spinal cord injury, or cerebral palsy, people whose lives will have been turned upside down, who are now vulnerable in a way that they were not before. So it's about making sure that you understand your client and their needs thoroughly, and making sure that things are in place to meet those needs. It's also about helping your client to achieve their aspirations. They have the rest of their lives in front of them, but the brain injury or whatever it was will have changed things significantly.
So is that like,
they will still have aspirations.
So is it the case that you're more like an advocate for them, or is it that you're more a consultant or counsellor for them? How does that tend to work
Well,
out?
it's all of those. It's a multifaceted role, and I guess the assessment is the first thing, as it is for practitioners in almost any situation. I can't think of any where it's not. So it's about getting to know them inside out, really. What happened to them, who they are, who they were, who they are now, how they see that, and then you take it from there.
And does that mean that that a case manager is generally then more like a referee between all the various places to try and make sure they do what they need to do, because you can't obviously be everything, but you need to get other people who are.
Yes, and so you stop being a therapist if you started off as I did as a therapist. You stop being a therapist, and you have to develop a whole lot of different skills, really. But it's about your assessment will tell you the sorts of things that your client needs. Might be physiotherapy, it might be speech and language therapy, might be a new house, a different kind of house, might be that it needs adaptation. I mean, it could be, to do with any aspect of their life. So no, of course, one person isn't going to be able to deal with all of that. It's about knowing a man who can.
Okay.
It's about being able to say, okay, right, I know somebody who might be able to help, or you may not know and have to go and find out, but that's all part of the job. Yeah.
And about when the assessment is done, is it an assessment that you would do that's a checklist you guys have, or is that something that you'd get like an assessment of need or something from a hospital? How does that tend to work out?
Well, probably both. I mean, I think as a case manager, you would assess, you have a case management assessment, but that might well indicate that other assessments are needed. So if someone's having difficulty with communicating, well then you would flag that up. So that's kind of the first stage, but then you need something that's going to be much more thorough than that.
And is there a sort of set of standard assessments that case managers would use, or a checklist or forms, or is it down to each individual case manager to work out what it is?
I certainly, from my own practice, I had a standardised form, which I treated as a starting point. Yeah.
But there's nothing there's no like official, like you'd have for speech therapy, occupational therapy, or psychology, set standard forms that are recognised everywhere, but there's no starting point of that for case managers.
There is. The form that I used was actually Australian devised, at the University of Sydney, I think she is, Robin Tate. I'm not sure how widely that's used, but there are assessment procedures that I guess I don't think most people would develop their own. I think you'd maybe start there, but that's the one I used. There are American procedures
And
as well.
Did you ever find it hard to get, not recognition is probably the wrong word, but other professions to recognise the assessments of what you've done and what you say needs to be done? Or would you always have to persuade the OT or a psychologist, etc., that they need to do this referral, or they say go to a GP first or something?
Well, I guess if there are referral procedures that include going to a GP, say, you would have to do that. No, I didn't ever have any difficulties. I guess because what you do as part of your own assessment is to prepare a report. Actually, initially for the client, of course, that's because that's who you're working. That's your main focus. So the person who with the brain injury or the spinal cord injury or whatever, and if it's a child, their family member, mum usually, would have been part of that. So they would be aware of things that need to be looked at. They would have their own concerns, which would help the prioritising. But you would then have this report to go to your psychologist, your speech and language therapist, your occupational therapist, the GP, whoever, and say, this is who we are, this is where we're at, this is what we think we need, can you help?